Hello and welcome. I am Dr. Ankit Parak. I work as a consultant in pediatric pulmonology, allergy, and sleep medicine at Children's Chest Clinic, New Delhi. Is your child's asthma well controlled? This is what we are going to talk about in this video. Now, as we know, asthma is the most common respiratory problem which is seen throughout the world. Children with asthma have chronic symptoms like coughing, wheezing, breathlessness, and sometimes they have asthma attacks as well. Most children are treated with asthma medicines, and if they are treated well, most of them actually can enjoy their childhood and adulthood and remain absolutely well. But world over experience suggests that most children and adults with asthma keep having symptoms, keep having asthma attacks. That means that they are not well controlled. Now, let's first understand what a good control means. So if a child's asthma is well controlled, then the child will not be having any daily symptoms. The child will not be having coughing, wheezing, breathlessness. The child will be able to sleep properly. The child will not get up frequently at night. The child will be able to participate in all sports and exercise. The child should not become wheezy or breathless after exercise. The child should be able to maintain his school attendance properly. And in addition, there should be no episodes where the breathlessness or cough increases, which are described as asthma flares or also known as asthma attacks. Well, why is a good control of asthma needed? Well, in a well-controlled asthma, the inflammation or swelling in the airways remains absolutely well. Now, if there is no inflammation or swelling inside the airways, then children will remain asymptomatic. They will remain absolutely well. So that's the first benefit. Now, in addition, if we do a lung function test or a breathing test in children with asthma who are having good control, their lung functions will remain normal. That means their lungs will be functioning at a normal capacity. On the other hand, if we do a breathing test in a child who has asthma and is not well controlled, their lung function test will show low results. And the third very important benefit is that if your child has a well-controlled asthma, then the chances of having asthma attacks are significantly reduced. Now, let's understand what are the common reasons for having a poorly controlled asthma. There could be many reasons why a child's asthma is not doing well. It could be a wrong diagnosis, which means the child actually does not have asthma. There could be other disorders which looks similar to asthma. They present with similar respiratory complaints, but the diagnosis is different. These disorders could be things like bronchiectasis, ciliary dyskinesias, cystic fibrosis, bronchopulmonary aspergillosis, etc. The other reason why a child with asthma may not be doing well is that the child is not getting medicines in a proper way. So the child doesn't get the inhaler therapy which the child is getting, is kept on nebulizations. Or the child is getting the inhaler but not getting it daily or in the desired dose in which it should be given. The child is getting medicines without a spacer, which means that they are getting the medicines in an improper way. One of the common reasons why a child's asthma may not be well controlled is that they have additional allergies like eye or nasal allergies or a sinusitis which does not let the asthma settle down. So if your child has an asthma which is poorly controlled, then what do we do about it? So let's usually start with a detailed history, looking at what has been happening to the child. When was he diagnosed? What has been the severity of asthma? What medicines you are taking? How you are taking the medicines? How the inhalers are being given? We would go on and do two basic investigations. One is a lung function test, which helps us to know the lung capacity of the child. And the other is the allergy test, which helps us to understand why the asthma is actually happening. Now, how do we treat a child who has poorly controlled asthma? So we would start by again a detailed understanding why the asthma is not well controlled. It requires a detailed asthma education, which involves training how to take inhalers and spacers, avoidance of triggers, and using an asthma action plan. We would also adjust the medicines of the child to gain the maximum benefit. And in some children, we might have to add another medication known as an anti-IgE therapy or omalizumab. So if your child asthma is not getting well controlled, you need to get in touch with a pediatric pulmonologist or allergist to get a proper diagnosis, to get evaluation, get a lung function, get an allergy test, and then get your therapy adjusted so that your child can remain absolutely well. Thank you.